Anencephaly is a fatal birth defect characterized by the absence of a scalp, skull, and forebrain. Diagnosis can be detected with high certainty through ultrasound during the second trimester of pregnancy. Prognosis is typically death within a few hours or days after birth. The use of anesthetic newborns as potential organ donors before whole brain death is in the midst of an ongoing controversy. Provincial laws regarding organ transplantation are based on two optional criteria: neurological determination, the cessation of blood flow to the cerebellum, or cardiorespiratory determination of blood circulation and respiration before transplantation. Ideally, a greater number of undamaged organs can be retrieved from individuals classified as neurologically dead. Since anesthetic newborns do not have cerebellum, the laws for organ transplantation regarding anesthetic patients are blurred and rarely occurs. Conversely, the death of functional proportions of anesthetic brains are often too slow, subsequently by the time that organs are usually too damaged for transplantation. Organ transplantation from anesthetic newborns before the WBD can serve as a potential life-saving practice. I will argue that organ transplantation before WBD in anesthetic newborns, regardless of ethical controversy against it, can be justified and should be conducted. My argument branches from current legal inconsistencies with specific reference to Robert Troe's "Is It Time to Abandon Brain Death?" A report suggesting current laws regarding organ transplantation are in need of amendments. Furthermore, I will support my argument through analysis of counter-argument by John D. Aris and Shumo Shinar in Anesthetic Newborns Are as Organ Donors, a Critique, an excerpt arguing against organ transplantation as a respectful measure. Coupled together through assessments of validity of both reports, justification on this practice can be made. Troe's argument is based on flaws of the current legal system for classifying a dead individual viable for organ transplantation. In Troe's perspective, most issues regarding organ transplantation can be resolved through the proposal of a new criteria for organ transplantation. Currently, there are two criteria indicating death of a patient. Of these, controversial lies in the neurological criteria forming the brain dead criterion. Some of the flaws in the brain dead criterion are as follows: the presence of neurohomofunction and electric brain activity, and the rise in blood pressure and/or heart rate during surgery of individuals considered as brain dead. The substances of large brain damage with current medical technology are not possible without performing an autopsy. However, transplantation of most organs can only occur if the individual is still breathing. Therefore, autopsy is not a viable criterion for organ transplantation. This also rules out the cardiorespiratory standard as a viable criterion. Lastly, with current medical technology, many brain function can be replaced with artificial tools, rendering brain dead as a questionable standard. Keeping in mind that the best possible policy is the one that satisfies the general public consensus, revisions in the current model may be a necessity. It must also be taken into consideration that physicians, doctors, and surgeons are not out to steal organs for the benefits of others. Mostly are simply trying to save lives, and there is a great need for organs to save people. Surgeons want organs from those who don't want to be harmed in the procedure. Donating a permanently unconscious newborn's organ in order to save others rather than waiting for their passing may be more valuable to the parents of the newborn. Thus, if an individual ever gain consciousness, it should be rendered individual viable for organ transplantation. The problem lies in the method used to justify whether someone is actually dead. In fact, a survey from Younger is revealed that 1/3 of surgeons may not believe that a person who falls under the brain dead criterion are actually dead. The reason that they do not transport is because they believe that the individual is in a state of irreversible unconsciousness or imminently dying.